The winner of Aster Guardian's Global Nursing Award 2025 is okay, I'm going to try and pronounce this right. Naomi Ohene Oti from Ghana.
A big round of applause for Naomi. Well done to you.
Thank you very much. Your Excellencies, our esteemed organizers, Aster DM Healthcare, the Chairman, Tazad Mopin, our respected judges, distinguished guests, fellow nurses, and supporters from all around the world. First and foremost, to God be the glory for this incredible honor. I stand before you deeply humbled and profoundly grateful to accept the Aster Guardian Global Nursing Award 2025. This is not just my victory, it is a recognition of the resilience, compassion, and leadership of nurses across Ghana, Africa, and the world. Over 2 decades ago, I began my nursing journey with a simple mission: to ease pain, bring hope, and walk alongside those battling cancer. In sub-Saharan Africa, I have witnessed firsthand the inequities in cancer care, especially in the resourced communities. But I've also seen the immense potential of nurses to lead transformative change. My passion for oncology nursing was born out of a desire to bring this gap and deliver compassionate, high-quality care to those who need it most. This award affirms that dream and empowers me to do even more. It is more than a recognition. It is a catalyst for lasting change. I'm committed to using it to amplify the voice of African nurses, expand access to cancer care, and build a legacy of leadership and excellence in oncology nursing across our continent. This award, as said, is not mine alone. It belongs to every patient I have served, every nurse I have mentored, every colleague who have joined in this vision of equity in cancer care. I extend my heartfelt appreciation to the government of Ghana, especially the Minister of Health, for creating an enabling environment for healthcare professionals. Also, the entire CEO and the entire staff of Kolebu Teaching Hospital, the director and the staff of National Radiotherapy Oncology and Nuclear Medicine Center, my professional home and foundation, and then Global Nursing and Midwifery Fraternity, the president of the entire membership of Ghana Registered Nurses and Midwife Association, the Guyana Diaspora Nurses Association for their leadership and advocacy, the Church of Pentecost, the leadership, Apostle Eric Nyamiche, and the executives and members for their spiritual support and prayers, my mentors, my colleagues whose guidance have shaped my professional growth, my parents, siblings, and in-law for nurturing and standing by me, my husband who is here with me today, and our 3 wonderful children. Your love and sacrifice give me strength. The entire nursing and midwifery fraternity in Ghana and abroad, your dedication inspires me daily. And the membership of AORTIC, African Organization for Research, Training in Cancer Care, the International Society of Nurses and Cancer Care, and CCAN for amplifying African nurses' voices on the global stage. Our media partners, and also my publicity committee for sharing our story with integrity and passion. To my designers, Nana Hima, Vessels, Christy Brown, I say thank you for letting me be confident and elegant. To all my fans and supporters and every single person who voted, thank you for believing in me. A special thanks to you, to Dr. Azad Mopen, Aster DM Healthcare, for establishing and supporting the Aster Guidance Global Award. Also to our grand jury, who also supported this cause. This initiative empowers nurses globally, and I'm grateful for the platform it has given me to further my mission in oncology nursing as I reflect on the prize. I'm committed to completing the African Cancer Nurses Competencies Framework, launching a cancer genetic counseling program, and establishing an educational scholarship fund, and also creating the African Leadership Academy for cancer nurses. This initiative will bring capacity, strengthen system, and ensure that quality cancer care is a right, not a privilege. To every nurse who listens, to my colleagues who are here with me today, your hands heal, your voice advocates, your heart leads. Together we are shaping the future. One patient, one moment, one act of courage at a time. Thank you very much. May God richly bless you all. Thank you very much. This is not just my victory, it is a recognition of the resilience, compassion, and leadership of nurses across Ghana, Africa, and the world. Over 2 decades ago, I began my nursing journey with a simple mission: to ease pain, bring hope, and walk alongside those battling cancer. This award, as said, is not mine alone. It belongs to every patient I have served, every nurse I have mentored, every colleague who have joined in this vision of equity in cancer care. This initiative empowers nurses globally, and I'm grateful for the platform it has given me to further my mission in oncology nursing as I reflect on the prize. I'm committed to completing the African Cancer Nurses Competencies Framework, launching a cancer genetic counseling program, and establishing an educational scholarship fund, and also creating the African Leadership Academy for cancer nurses.
Dr. Azad Mupen, Excellencies, dear colleagues and friends. My greetings to the esteemed guests from the government of the United Arab Emirates, along with the health associations and all of the nurses watching today. I commend Dr. Mupen for his commitment to recognizing the critical contributions of nurses. Earlier this month, WHO published the State of the World's Nursing Report for 2025. It provides both hope and urgency. The global nursing workforce has grown to nearly 30 million, but these nurses are not distributed equally around the world. Countries that make up less than half of the world's population have almost 80% of the world's nurses. Meanwhile, Africa and the Eastern Mediterranean region face severe shortages. These inequalities affect people and communities on a daily basis and undermine progress towards universal health coverage. At the World Health Assembly last week, WHO's member states decided to extend the global strategic directions for nursing and midwifery until 2030 to support countries to build the capacity of their health workforce. We need urgent, sustained investments in nursing education, jobs, leadership, and working conditions informed by data, driven by equity, and inspired by the courage and compassion of nurses. My congratulations to the nurses being recognized today. To you and to all nurses, I offer my deep thanks for everything you do to make the world a healthier, safer, fairer place. Shukran jazilan. I thank you.
So they say that there are 29.5 million nurses across the world, and they make up almost 50% of the global healthcare workforce. And that's a huge majority of the entire workforce of healthcare. And it's very important for us to remember that they play such a central role because they spend the maximum amount of time both with our patients as well as our doctors. So when we talk about taking healthcare from good to great, we always say that the nurses become that glue and that scaffold to enable this journey from good to great. So today, I just want to end with a lovely quote that I read, which I think summarizes how we all believe and think about nurses. There are some people who have sun inside them. It's hard to explain. Their presence just brightens, And it's not about their beautiful smiles. They have an internal being that sheds light and feels like sun. It's calm energy, inner peace. But most importantly, it's not wanting anything in return. It's sun.